most cancer research to this point has been funded by the federal government, and that's been an important source of research funds for our work. And so because of issues with the federal budget deficit, the research funding from the federal government has become more and more difficult to come by. And if you look to the future, it's clear that the NIH budget is likely to be flat. Best case scenario, it certainly isn't going to grow over the next few years. And so the goal with research funding for PTC11 is to generate exciting preliminary data or preclinical data or even clinical data that we can then leverage when we go to apply for these bigger grants that are sponsored by the government or by other potential funders of cancer research. And so that's been a critical step for us, is to get the initial funding, to get the teams together to generate the data. And so I think for us, the PTC money was critical, and it actually has resulted in several grants that have been submitted to the NIH, several of which have scored very well and are likely to receive funding. So it takes the initial investment from PTC and turns it into a much bigger resource that we can use to further the program in pancreas cancer here at the university. And it will be, it will impact and touch patients' lives because it's true translational research where new trials will be open and we'll be studying novel treatments and that sort of thing. So the money has direct impact, and it has potentially immediate impact to the patient that's suffering with this disease. So we can take money from PTC and leverage that into getting bigger support for our funds. And so that's obviously the goal. That shows the success of a project like that, if you can look at it and see that it generated data that led to bigger studies. And so I think with the PTC team money that we received, that's exactly what's happening. That's what, we're excited about that. So my dream would be for all of this research funding to one day put me out of a job where we don't have to do these difficult operations on patients to cure them of their cancer. I'm ready, yes. We're building the team, and we're going to be bigger and better, and there's going to be more of us. And those of us who did 25 miles last year are going to do 50 this year, and those that did 50 are going to do 75. So
tell Hawkins we have a century ride this year.
A century ride, okay. I had one patient who is a cancer survivor who was not too far out from his surgery. He rode 75 miles, so that's kind of an inspiration to me. If he can do it, then I should be able to. So.